Lyme disease, a microbial threat to human health. The basics of Lyme disease. Lyme disease is a bacterial infection that is an emerging threat to people's general health, particularly in parts of US, Canada, and Europe. Lyme disease has been bewildering the medical fraternity with its stealthy nature of attack, multisystemic presentation, as well as an intricate immune system responses. It is a spiral-shaped bacterium, Borrelia burgdorferi, which is passed on when an infected black-legged deer takes bites. Here are some pictures of the spiral cells and of the bacteria. B. burgdorferi is gram-negative. It has a linear chromosome and several plasmids, unlike others. The plasmids carry genes that are essential to their infectivity and survival. The flagellate-like structures are responsible for giving motility to the bacteria. Mechanism and entry points of Lyme disease. The transmission starts with the attachment of a tick with B. burgdorferi to a human. The bacteria needs about 36 to 48 hours of tick attachment to be transferred. Tick saliva inhibits the host's immune system while feeding and allows for bacterial entry. B. burgdorferi then spreads via skin, blood, and lymphatic pathways, avoiding the immune system and propagating extreme inflammation backed by the bacteria is the focus of the disease's development. Immune response and symptoms of Lyme disease. The early localized phase is when the patient gets a typical rash, which is circular and known as erythema migrans, resembling a bullseye. It is accompanied by fever, fatigue, headache, and stiffness. In the early disseminated phase, the symptoms are more serious and systemic, such as Bell's palsy, meningitis, heart palpitations, and radicular pain. Chronic arthritis, most commonly of large joints, such as the knees, is frequent in the late disseminated stage, usually during the late stages of infection. Down below in this picture are some of the examples of early phase, chronic arthritis, and late stages. Medical responses and treatments. Lyme disease should be treated promptly to avoid complications. A round of oral antibiotics, doxycycline or amoxicillin. These antibiotics target the synthesis of protein in bacteria and therefore prevent replication. Approximately 10 to 20% of patients have symptoms that persist. The etiology of PTLDS is unknown. Supportive Lyme disease treatment encompasses anti-inflammatory drugs for arthritis, corticosteroids when neurological issues are severe, and physical therapy. Lyme disease severity and long-term complications greatly depend on early identification and diagnosis, most often performed by examining patient history and laboratory tests, including ELISA with the subsequent Western blot test. Unique characteristics of Borrelia burgdorferi. The genomic structure can be defined as one of its most peculiar aspects. Unlike most bacteria, it contains a segmented genome, a linear chromosome, and over 20 circular and linear plasmids. Such plasmids encode outer surface proteins. which are important in evading the host immune system and establishing the infection. The other distinctive characteristic is its metabolic constraints. B. bacteriophage undergoes antigenic variation, a mechanism by which surface proteins alter and evade immune system. B. bacteriophage cannot metabolize most nutrients, a highly specialized genome that enables it to inhabit in mammalian ecosystems. Prevention and public health implications. The best approach towards Lyme disease is still prevention. It is important to avoid tick-dense areas during peak season. Apply insect repellents that contain DEET or permethrin. Dress in a way that covers your body to include your head, and wear permethrin-treated clothing. Conduct a thorough body tick check after being outdoors. Immediate removal of ticks significantly lowers the chance of infection. There are activities to educate the population in the areas with ticks to make people aware of Lyme disease and motivate them to act in a way that helps minimize the risk. Future protection is possible with ongoing studies of a human vaccine that was once on the market but pulled off in the early 2000s. Conclusion. Lyme disease is a disease caused by Borrelia burgdorferi. It is the result of a completed interaction of a stealth pathogen with the human immune system. It comes with serious health problems with its immune evasion capability, spread throughout the body, and tendency to cause chronic complications. To reduce the effects of Lyme disease, you must treat it at its earliest stage.